8 states of northeastern area, region. It's a special focused effort. We all know that we have been fighting against AIDS, HIV, and in this response, it is a focused effort where we are trying to see to it that we respond to the issues which we face in northeastern region. Before I speak on the issue, I would like to make it very clear, as Mr. Kang has also done it, that our NACO program is to continue with the same spirit and with the same intensity. It is not to deviate from that. It is an additional supplement which we are trying to give by this special Sunrise program. So our NACO program, National AIDS Control Organization, which is the routine program which we have undertaken, that is to be done with full intensity. And along with this, because of special issues which have come up in this region, that has to be addressed. So for that, this Sunrise program has been undertaken. AIDS control program has done a very good work. And this is not which I am saying, this has been globally recognized also. The prevalence of AIDS cases has dropped considerably. The new infection cases has declined very steadily, and the deaths due to HIV/AIDS has also dropped to a considerable level. All this has been done with the support and the active support of all the stakeholders. It's not only the NACO which is doing, it's not only the health ministry which is doing, it is all the stakeholders who are working day in and day out. Because of that we have been able to do a considerable good program and good results as far as the containing of the HIV infection is concerned, the prevalence is concerned, and deaths taking place due to HIV. But one thing is there, that the success has not been as much as we thought in the northeastern region. This is also which is to be understood. The prevalence in Manipur itself is more than 1.1%. Nagaland is only one of the states where the prevalence is more than 1% in the pregnant women. So these are issues of concern, and the interventions which we are launching today has been done with multiple consultations. I heard the first speaker speaking from the community with a lot of emotions involved, which we respect, and we have to address those issues. But we are trying to see to it that the community level involvement is there. And this program has come out with the consultation for the last 1 or 2 years. The consultation process has been undertaken. All stakeholders have been involved. And we are proud to say that the affected communities have also been undertaken while formulating this program. Dr. Pollan will certainly support me in this, that she has also done a very good job and by involving the community and involving the stakeholders. We all know that here, because of the drug use, and that to the injectable drug use, the prevalence of HIV in this region is an issue which needs to be addressed. The drug addiction, primarily affecting the adolescents and the young people, is also a real cause of worry. And the AIDS use prevalence throughout the country is 10%. But somewhere it is 20% also. And northeastern region needs to address this issue. So this is one area where, because of the drug use and because of the statistics showing that it is, in some pockets it is more than 10%, is an issue which needs to be addressed. No doubt, with all the support from the Government of India and good work done by the state governments also and responding accordingly in a very positive manner, you have been able to develop the capacity building process in a very steady manner. the HIV testing facilities, the expansion of the various preventive interventions, testing and treatment, and people living with HIV, which we call as PHIV, people living with HIV. They're addressing those issues and giving them the free medical treatment has been up to the mark, and that is what the facility, I will say that the capacity building is on, and it is picking up, and we are trying to see to it, and the state governments are also responding. When I come to Manipur, here the NACO program is one of the first to start in India. It was in 1992 when we started this program. And in that point of time, 1992, many parts of the country did not know about the NACO program. You have also the privilege to come out with the AIDS policy. In 1996, you came out with the state AIDS policy, which was formulated by the state control program. And I was told by Mr. Jha just morning that you also revisited and came out with the new program last year only. So these are the things which you have done, and because of that, I will say that way, in a way, Manipur has been a pioneer in giving advices to the other parts of the states and how we can work and sharing the learnings. So that has been there. The HIV prevalence IDUs has also reduced considerably. Here I would like to appreciate. From 24% in 2003, it has reduced to 12.1%, which is a very considerable marking and which we should understand. We are also working on the national harm reduction strategies, and today when we are talking about Sunrise, it is the program where with the national harm reduction strategy is foremost in our mind, and we are trying to see to it that how do we go forward in this direction. Sunrise will be implemented in 5 years, and approximately some 70 crores is being spent on this program. It will be a 5-year program. It will be rolled out in 20 focus districts. I must thank the CDC Atlanta for this support. It's making availability. People think when we talk about the reduction of the harm strategies, one of the initiatives which we have taken is to increase the availability of these safe needle syringes. This is one strategy which we have undertaken, and the another is the pilot studies have been done, and then we have gone for take-home policy on the opioid substitution drugs. This is another second strategy which we have undertaken. We feel that because of taking these strategies, we will be able to see to it that we reduce the prevalence of HIV infection, and we also see to it that people who live with less harm, with little harm, and so harm reduction strategy is going to be taken into this consideration. Government of India is committed for the NACO program. Here I would like to make it very clear that the NACO, National AIDS Control Organization, the total program is 100% centrally sponsored program. So the center takes the responsibility of eliminating and reducing, and people living with AIDS should be taken care of, and that the Government of India has decided, and we are working in that direction. The second thing which I would like to say is that we have developed a strategy where the NACO funds are straight away going to be released to the state NACO society, state AIDS control society. I heard Mr. Haig was talking and was about the funds problem. The funds problems were basically because when the funds were being released, it went to the government treasury. And then the government treasury used to give it to the state AIDS control society. So, as you all know, when the government functions, their priorities differ from place to place and time to time. So, there is a question of releasing of the funds at the right time, at the right moment. So we have decided now that the state society will be getting funds directly from the NACO to the State AIDS Control Society. That is resolved. And I think that is going to make it very good. Here I would also like to make it very clear that the Government of India is committed to help and see to it that the AIDS, people living with AIDS, should be supported. Keeping this factor in view, last year on the AIDS Day I declared, that was on 1st of December, I declared that the cutoff level of CD4 count of AIDS patient, which was 350, has been increased to 500, and we have taken all those people, so nearly 1 lakh people more will be covered with the treatment of HIV. That is what the Government of India has done. So we have at least 1 lakh people are going to be now covered to this process. So we are trying to see to it, and when I was the Member of Parliament and member of the Health Standing Committee, the activists of the AIDS fighting organizations used to come and meet me, and they used to say that raise this CD count 4 and see to it that we should get drugs. At that point of time, I only said that I'll try. I never knew that God will give me an opportunity to do it by my own hands. I got that opportunity. I really thank God. But at the same time, the government stands committed, our ministry stands committed for giving you the best facility, for giving the best facilities to fight AIDS. I would like to also just a very stray idea I would like to share with you. Medicines, along with medicines, this needs some emotional touch also. Now, what strategies to be adopted? Because when the member from the community was speaking, there were issues related not only to the support, the logistic supports. It was also issues related to the emotional and the social background which has to be addressed. So we feel that we should also see to it that how do we address these issues so that a HIV infected person is also within the mainstream in the best possible manner. Of course, there are legal issues which have been addressed very properly by the law department and the judiciary, and the rights have been protected in the best possible manner. But social awareness is also one aspect which has to be taken into consideration. Ministry is thinking very seriously on this ground because we want that the awareness level on this issue should be enhanced. So we are trying to do our best, but with all the support of stakeholders, any suggestions which may come in this direction also will be very helpful for the ministry, which we would like to involve. Once again, I hope and I'm fully confident that this substitutional effort by Project Sunrise is going to help you, and Northeast is going to become healthier and AIDS free. That is what I wish. Thank you very much.